Take two. Welcome to Math 119-312. We have a special guest today, the president of Williams. Professor Mandel is going to be here to answer some questions from the class. So I will turn it over. People who are in the Zoom chat just monitor who's coming in, and I will do so as well.
Hi, everybody. Hi, everybody. This is the first time I've done the hybrid format. Can you hear me okay out there in Zoom land? Give me a thumbs up, yeah?
Yeah, we can hear you well.
Okay, and you guys can hear? Okay, good. So thanks for inviting me. Although was abstractly involved with making sure that we had classes on campus, not even that abstractly, I haven't actually set foot in a classroom since this all started. So it's I participated in a mock class in the summer to see how this would go, the hybrid format. But this is my first time to actually do it. So I'm glad to have the opportunity to say hello to all of you here and to all of you here, and to get engaged in a conversation about how we did what we did and how we're doing what we're doing this semester. So Steve said he would be fine and you all would be fine just doing this in question form rather than having me give some kind of formal presentation. So so why don't we just turn to your questions? Yeah,
so we were just gonna give you a couple questions.
Are you muted, Paul? Or is this your, okay, hold on. Try again, Paul.
Is that a little bit better?
Perfect. Now I can.
All right. Yeah, so just a brief synopsis of what we were thinking, how this would go. We were going to give you a couple questions that would take up probably a good amount of the class, and then open it up to general Q&A from either in Zoom land or in Williams. So first off, we're going to talk about the spring decision to send us all home. So the decision in March to send everyone home was probably guided by the available information at the time, the lack of time to make campus improvements, excuse me, and in part the politics of the other schools' decisions. Would you still have made the same decision looking back if you had all the information that's available now? And would you have done anything differently? And finally, what other options were you considering?
So I have said publicly that March was the hardest decision I've ever made in my life. I'm not actually sure now that stands because there were some decisions in the summer that turned out to be harder in some ways, which we can talk about. But it was an extremely difficult decision in part because how little information we had. So we had been tracking COVID and the developments beginning in January. And we had a group of people who were talking about the impact, and we were all talking about it. I was on the road for Williams about a week. I forget the exact dates, but I came back at the end of the first week of March, so maybe March 4th. And you know, things were really building. But I can tell you at that moment, and based on the information I had, I wasn't planning on closing. So this all happened very quickly. In terms of information, I think what made it the hardest decision in my life is I like to think of campuses as places where we make decisions based on deep evidence. And actually, we didn't have a lot of evidence. What we had was a lot of anxiety and reports, and no infrastructure set up at the time to assess the level of threat. And later, as we'll talk about, I started to get informed by people who actually knew something. But at the time, I was being informed by people who were reading the newspaper, which is different, not insignificant, but it was a different set of information. So if your question is, would I, given the information I had, would I make the same decision to shut that I did then? In other words, not if I knew then what I knew now, but if I knew then what I knew then, yes, I would make the same decision. And in part, I can tell you that you know, what I wrote about at the time was really very honest, which is that I was most worried, given what I knew, which was not very much, I was most worried what impact Williams College would have on the local medical infrastructure in Berkshire County. That was the thing that, it wasn't the only thing I was worried about, but in terms of rank order of things I was worried about, that was one of the highest levels of concern. Because I was worried, given what I knew at the time, that if Williams students got very sick and had to go to the hospital and take beds from people who were elderly or immunocompromised, we would have out of sort of the size and scale of our population would have an impact on the region that could be deadly. And I was really worried about that. So that was one thing I was worried about. I was also worried about the impact of the disease on students. We had a sense that young people weren't likely going to be endangered, but we didn't really know very much at the time. So I was certainly worried about all of you. And then I was worried in the abstract about the impact of spread elsewhere, what would happen if we let this get out of hand in our community, which we couldn't trace in any way, and then later sent you out into the world. So it was all really happening in real time. But the thing that has the biggest impact on me, just being really honest, was when Princeton made the decision they did. And it wasn't a peer pressure issue. It goes back to something I said to you before, which is I wasn't talking to a lot of specialists. So when Princeton, with its public health infrastructure and its vast scientific enterprise, made a decision based on what they knew, and this started to happen with schools that had pretty serious medical schools attached to them. When they made that decision, I essentially what I thought was, who am I to second guess those folks? They know a lot more than I do. And it's probably hubris to try to do something else. So it wasn't so much other small liberal arts colleges, although it wasn't, just from a politics standpoint, it was helpful that we all sort of fell roughly in the same week. It made it very difficult though, because, and it may have been some of you, I had students crying in my office, really begging me not to do this, to be strong, to be a leader, to not close. So it was a very emotionally challenging week. But those were some of the factors that were influencing us.
Thank you. Yeah, so now we're going to turn it over to Annabelle, and she's going to ask you a couple questions about the decision to come back in the fall and some of the metrics that went into that.
Sure.
So throughout the summer, a lot of schools had to make very important choices about how they were going to hold classes during the fall semester. Williams decided to offer students the option to return, study remote, or take time off. What were the factors that made you feel that it was safe to bring students back compared to other schools that chose different models or to move completely online?
One of the things I started to say almost immediately at the end of March is that one of the things that it was the hardest decision I ever made, but it was made easier very quickly by the fact that every single institution in the United States, almost in higher ed, made the same decision within a few days of each other. So it very quickly felt like a wave. And one of the things I started to say at the time was that what was going to be different about the fall was we were going to make different decisions from each other, and that was going to make it much harder. And in fact, that is exactly what happened. So I say that as the end of the story. So the question is, your very good question, sort of how did we get from the chaos of March to deciding to open? And I don't remember from pre-reading the questions if you have this as a separate question, but I want to break it into two phases. I'm going to answer the question you asked, but then remind me to answer the next question, which is, once we made the decision, how did we stick to it? Because that was actually proved to be much harder. Let me start though with what you asked. So I'm a historian, so I think in terms of time arcs. So I'm going to do this in terms of a time arc. So April was the month that I would describe. I was describing that month as the month that my brain would melt every day at the end of every day, and that was because in April we were considering every possible scenario. So every meeting, and there were dozens of meetings with different constituents and kinds of people. We're considering everything from, close the school, go remote, break into quarter systems, into trimester systems, go pass fail, don't go pass fail, sometimes go pass fail, bring back freshmen, bring back seniors. I mean, really every possible scenario was on the table, and all had pros and cons, and all had advocates and opponents. And so it was it wasn't uninteresting. It wasn't even stressful like March really yet, because we had time. It was more exhausting in this just sort of mind melting situation. So that went on for a while. And I had a bit of an epiphany somewhere, I want to say at the end of April, where I thought, okay, we need to narrow down our options. We need a couple of paths. I think at that point we were at 9. I think we were at 9 paths, right? We had a committee then that was working on 9 scenarios. And I had gotten them going. I was, to like pat on the back, I was very pleased. I'd gotten the committee to create those 9 scenarios going very quickly. So that was something I had realized early on, that we needed some scenarios, but we just had too many at that point. And so this epiphany moment, it might have been in early May, was I needed to get us on onto 2 or 3. And I needed to shut down all the other options and get the 2 or 3 to move forward, even though they were opposite each other, as if each of them would happen. So I started to talk about that as my 2-branch tree. So one, we quickly got from 3 to 2, and the 2 were, in essence, go fully remote. What would that take? What are all of the issues we'd need to work out? What are all the questions and dilemmas and data we need, all of that? And what would it take to open and get another group working on that? And from that moment, and we announced those committees, I believe, in early June, end of May, early June, until we announced the decision to open. Maybe it was even earlier than that we had those committees going. I felt it was the calmest part of the entire period from March through August, because now we knew it was going to be one of 2 things, and a big decision was made right at the turning point of that, which was that we would not trimester. We debated that was the 3rd possibility, a trimester option. We got that off the table and got ourselves into 2 buckets, or two branches. That was really the moment that things simplified significantly. And my running sort of philosophical commitment at that moment was, we just have to make this as easy as possible. That the trimester system, all of these added complications, I say this to everyone here, just small things going to using the summer, which a lot of people liked, but involved faculty doing a level of work that it was just clear it was going to be much, much harder than it had to be. And so we just went to a mode of like, let's just make this as easy as possible, given how hard it is. And so for that moment, until the end of June, actually, it was much less stressful. The 2 committees started to work, and they just started to gather information. The remote, well, let's go fully remote, they did their work as if we were going to go fully remote, understanding we might not, or that we might have to in the middle of the year, and we'd come back to what they had done. And the other committee just started to gather data, and they broke into subcommittees, and they explored all the questions that, in a sense, retroactively they explored about what to open. And we had, I would say, dead ends in that process, or as we went through it, we were working on certain assumptions that I think proved to be totally wrong, which is, so I'll give you an example. I assembled a group of health advisors, because I told you what I was really lacking in March was information from specialists. So I wanted to get specialists involved. I wanted to talk to the hospitals, I wanted to talk to public health advisors. So I assembled a group of alumni health advisors, very well placed, and really smart and know their field, and we're following real time all the data of COVID. And the advice that they gave in June, which was totally made sense at the time, was that we shouldn't put too much emphasis on testing. That actually testing wasn't going to be the answer. The answer was going to be actually much simpler: mask wearing, hand washing, social distancing. That was what was going to be the answer. And it worked well because we didn't have a really good testing option at the time, and we were planning to test, but it was going to be a much, much, much lighter testing infrastructure than we ended up setting in place. I don't think that would have prevented me from opening. I was working on the assumption that that was going to work, and we can talk about the Broad Institute and their impact on all of Massachusetts at a certain point. But that really came from outside of Williams. We were moving on a different path up until that point. So, and the question I put in front of that committee was, do you think we can pull this off? And the answer they gave me on June 30th was, yeah, we think we can do this. So that was the answer, and that was the assembled data that was pulled together from that period. The campus that opened at the end of August was not the campus necessarily that we had completely decided upon at the end of June. Other things happened in between. But based on the information I had available to me at the end of June, we thought we could do it. And I'll just say, Annabelle, I asked you to remind me to ask me this, and that just say though that we got new information in July, which made us second guess everything that had happened in June. But up until that point, the data we had, the information, the specialists, the local hospitals, et cetera, made us think we could do it. So I can answer any questions about that period before we go to the later period if you want, about why we thought so. If there's more, I can.
Yeah, so to continue off of that, you talked earlier about being worried about what bringing students would be like with the Berkshire health systems. What did your conversations with them look like? And did you also have conversations with the Williamstown Elementary or Mount Greylock as well?
My personal, hold on one second.
It's going to Zoom.
Okay, hold on one second.
Let's try that.
That better? Okay. Personally, I met with the head of both the Southern Vermont head of the medical center there and Berkshire. I didn't personally meet with the school district, but there are people who work for me who did. So there was input at different levels. And we were thinking a lot about childcare and what kinds of problems we were going to have both at Williams in our own childcare facility and in the school system. The meeting, I will tell you, the meeting with the hospitals happened fairly early, back in maybe late May. And that was an incredibly reassuring meeting. We continued to have conversations with them, but really right from the first meeting, they said, I believe the direct quote from one of them was, bring your students back. We can handle this. So that was, for me, that was huge, because if you remember back to March, that was one of the things I was really concerned about. And I think they were concerned about back in March. But by the time we got to June, they thought that they had a good sense of what COVID was going to be like in the Berkshires, what their capacity was, how many beds they have, how many ICU, what their ICUs like. They knew that. And so that was, for me, I think, very important input, because to me, in terms of managing risk and thinking about what our impact on the community was, I was turning to people who had some expertise in that area. And I will say they weren't ambivalent. They didn't give me a mixed message. It was a very clear message. So, and that never changed. Additionally, as we developed the plan, we talked, again, not so much me, but the folks who work in the senior staff who then would come back and report, talk to folks who work in the local public health board of health, the local board of health, excuse me, who again, even when there were folks at Williams who were very skeptical about whether we could do this well, they really looked at our plan closely and talked us through all the things we were planning to do. This was actually a little later in the summer, but their feedback was very positive. So the local hospital, the local public health officials and board of health were very encouraging, which is not just, and the town manager. Everybody sort of charged with making these decisions locally were encouraging us to go forward.
Thank you. So now we're going to move to Billy, who's going to ask some questions about the current situation, which is...
So actually, before Billy does that, can I just say something about July and August? Because I think it actually, in some ways, was the absolute hardest part of all of this. So I told you we got new information in July and August. On the positive side, I don't remember exactly when this happened. It actually probably was before July. It was, because we were able to announce it. The Broad Institute came forward and saved the state of Massachusetts, higher ed in the state of Massachusetts. So, I get a lot of compliments for what's happening at Williams, but I have to say, without the Broad Institute, I don't know if we'd be where we are. So this is this genomics lab in Cambridge that provides all of the testing that everybody who's here on campus is taking. It gets the test back to us in less than 24 hours, and that charges us only $25 a test. That was an incredible moment. And it changed the game, I think, in Massachusetts entirely, and it helps explain why folks throughout the state are doing very well, including Williams. So that's just one thing I want to note. Despite that, very good news, we had other inputs in July and August that made this very difficult, which is that COVID started to go up around the country dramatically, and anxiety rose significantly. And I want to say this here in your class as you study data and statistical models and math. I don't know how much you factor in anxiety as one of the data inputs, but for me, in July and August, one of the big data inputs was the number of hysterical emails that I was getting. That was a real thing, sort of telling me that I was going to commit a moral atrocity if we opened the school, that there was going to be widespread death, that it would be on my hands. So that was a real input in July and August, along with the data of rising cases that came to bear. And then there was another piece of it, which I think we'll get to in the next question too, which was a lot of people who supported the plan in the abstract, but the plan had to actually function, which meant we needed a certain number of facilities folks, people in dining, we needed people staffing the testing center, we needed that testing center up and built. We had to do it all. The plan was all well and good at the end of June, but now we had this period where we had to do it. And there were definitely moments in July and August where many people said to me, it can't be done. We can't do our plan. It's not going to happen. And that was very, very stressful and difficult. And I will tell you the kind of, insofar as there's a big reveal in this class, in this conversation, is the few moments in August where the debate about whether we should go fully remote was live. It was live. And when Mount Holyoke, Holy Cross, and Smith made that decision, that week was a very challenging week here at campus and really across higher ed, I think, in general. So we plowed forward for, I kept just working through the problems, trying to make sure that we had all those problems solved. We had most of them solved by the time we opened, and now I think we can move to the next question.
How's it going? So I guess just like kind of going off that question, in that plan to potentially go fully remote, what would you have done with incoming freshmen? And then once you address that, we can go to the current situation.
So that was one of the big questions in that moment. Should we de-densify right then and there, the way some other schools did? Like a week before everybody was planning to come back, should we just announce that only X group, freshmen, seniors, somebody, people who have no other place to go, should we just go fully remote? I don't think we would have ever gone fully remote. I think we would have, at the very least, brought back students who had unsafe spaces in which they were living and studying for however that would have been determined. I was never a fan. There were people who were pushing a de-densification strategy, fewer students. I was never really a fan of that, and I particularly became less and less a fan of it as we got closer to August, because the whole curriculum that we had set up assumed that we would have people from every class. And so if I had suddenly announced on August 20th that we're only bringing back seniors, or we're only bringing first-year students, now classes that were supposed to be in person that assumed that there would be a certain number of upperclassmen, and I didn't know how well this hybrid thing was going to work, but it just felt to me like it was really going to undermine the faculty who had been working all summer to make their courses go a certain way. So I really never considered that seriously, although there were people advocating it. I really was like, either we're really mostly remote or we're mostly here.
Awesome. So now the question that you originally had asked the community in the summer was, do you think we can pull this off? So now we're kind of looking towards, are we pulling it off right now? And so I'm wondering.
How'd we do?
Exactly.
It went pretty well. I'm happy about that. So I can't say it's, it was a risk, but I want to make clear in a class on mathematics, it was a calculated risk. I mean, the things we haven't, the thing I didn't say about August is back to what were the factors we were taking into consideration. So on the one hand, we had all this input and anxiety, and we had people here saying, we can't do it. We can't implement our plan. There are pieces of it we're not going to get done either in time or at all. So that was one piece of input. But the other input was data that I was looking at that was modeling COVID rates in September. And it looked likely, and I'm a historian, I'm no mathematician. So I had to rely on the expertise of others, but it looked to me pretty persuasive that numbers were going to go down. And that is, in fact, what all my public health advisors were now telling me. Again, the experts were saying to me, Williams can do this. Not every school can do this, but Williams can do it. And in fact, Williams should do it, because we need some schools to be able to demonstrate that this is doable in case we don't have a vaccine. Like, what is it going to take to do this safely? Can schools do this safely? So there was input coming in that suggested that it wasn't that risky. If the hospitals or the public health advisors or the modeling had suggested that this was likely to put people's lives on the line here at Williams in a way that I thought was viable, if people thought I was held that one opening and that I was just ignoring the data. And that's because the data in the moment was pretty scary, right? In July and August, the COVID data was pretty scary. but it's not what people were telling me was going to happen and what the likelihood was, and if we did this the right way, exactly how we did it, bringing people on. So I guess what I would tell you is it's going well. I wasn't terribly surprised that it went well because it was a risk. It was a calculated risk, but it was a risk that I thought would fall our way. It actually fell more our way than I expected. If you looked at the modeling before, I expected more cases of COVID when students came back than we actually got in that initial testing. Not by doubles and triples, but no, I wouldn't have been surprised if we had 10 to 12 cases, 8, somewhere in that range. You know, we didn't. We had much fewer, which of course then made people calm down. So the anxiety levels went down significantly, which was a huge help. And then students have been fantastic. Despite some of the press that has happened both nationally and even locally in the record, students really on campus have been terrific. We always knew not everybody was going to follow all the rules all the time. The plan couldn't rest on everybody following all the rules all the time, because that's not what people do. So that would have been a bad calculation. But enough of the people are following the rules enough of the time in the context we're in that has allowed it to go better than even I hoped.
Definitely. And so going off the fact that this is a math class and you talked a little bit about like broad metrics, you shared something with us that like talked about primary. Yeah, I was thinking maybe you could speak to that.
Yeah. So give me 1 second. I'm going to load that up.
So I don't know if everyone can see this, but you want to finish your question, Billy?
Sure. I guess my biggest question is, of these like subcategories in each metric, which have been most challenging, and if you were to rank them, what would it be?
Okay, so can everybody see it? It's sort of, so I'll just give you some, each thing doesn't matter so much, but you'll see there's primary indicators, behavioral operational indicators, and contextual indicators. So the primary indicators is the testing compliance, the daily positive ratio, the 7-day average positive ratio, and student isolations. That is, isolation is students who are tested positive and going back to isolation, which is different than quarantining. Those of you who happen to be exposed and are quarantined. So that's, and you'll see that there's a green, yellow, red. So our grid was set up so that we could daily evaluate, are we in the green, are we in the yellow, or in the red. It doesn't presuppose, and this isn't quite your question, Billy, but it doesn't presuppose an action. So if we hit red, how many reds do we have to hit before we do X thing? It doesn't presuppose that, because I think data is data, and then you make your decisions based on the data, but it's not a simple, excuse me, Steve, mathematical calculation.
I would like to talk to some other people that explain that to them.
Right, right. So it isn't actually a simple mathematical calculation, but this data matters a tremendous amount, in part because a lot of it you don't know, and frankly, most people don't know, and so there's an assumption. I'll share a story with you in a minute about this, but there's an assumption about the data. So you actually need the real data before you can even have the conversation about what you should do and where you would hit a tipping point, what your campus, your town, your community can survive, as it were. I don't mean medically. I mean actually psychologically. What can it handle? And I don't know. I still don't know the answer to that because we haven't gone in that direction yet. I can tell you Trinity College has had a couple of massive outbreaks, and they've had to lock everybody down. So all courses went remote. You could go out to get your food, but basically the library's closed, the gym is closed, it's over and for 2 weeks, and then they're now coming out of it. They survived it, by the way. So that answers that question. Like, I think probably pretty unpleasant for the president. I haven't chatted with her lately. She's been kind of busy, but they didn't send everybody home, and they have, I think, a total now. I don't look today, but I think they were in the 80s since opening of the number of active testing positive cases. Well, you compare that to our 5, and realize that they've managed to move on. So that suggests that community can handle some larger number, but So it doesn't presuppose an action. In terms of the things that, to answer your question, Billy, it's a funny thing to answer because I don't think of it in ranked order. Obviously, every time I hear that somebody tests positive on this campus, I get a stomach ache. so for me personally, that number, because I immediately worry, who was that person? Where did that person get it? And who they were exposed to, and who else did they expose that I don't know about? So there's this fear factor that's folded into this. And until I have data to answer that question, so far it's been very good in all instances. That's a kind of a scary moment. So that's got to, that's high up there. Very, very high up. But diminishing over time is the first issue on the second under the red, which is student violations. So I can tell you, and I think it's fair to share, that people were really scared about how students were going to behave. I think that was high up in the anxiety of people who were nervous about opening. And that's come way down. And it's come way down, frankly, and I can only use every public opportunity that I can to say it, thanks to the way students have navigated this experience. You guys have been a very small subset, whoever's listening, but I just want to say, fantastic. And it has helped bring down that particular indicator. So back in September, that would have been really high. It's come down over time for me. Testing, I would say, after kind of number of actual cases, the second most important thing has been testing compliance. And that's another thing. I think if you had asked me back in June or July, are people going to sleep through their tests? Are they going to miss them? I would have thought that there would have been a higher level of non-compliance, and it's been really good. And that too is really great, because while testing can't prevent COVID much, even though there's some misunderstanding about that out in the world, it is actually, and this goes back to June and things we didn't understand, it has been huge at Williams, but also in other places, in helping contain things very quickly. So Trinity is a great case where they caught the outbreak. It was largely a couple of off-campus houses, spread very quickly in those off-campus houses. But then everybody went into isolation and quarantine, and they were able to, as far as I can tell, based on their data that's coming out, they were able to shut it down. So testing, knowing, having people being honest in contact tracing, and then that's really key data. And then
Awesome.
Other data, I do want to note that some of what you can't see here, but has to do with, and this was less visible to everybody else and would have been really hard to explain if we had decided to go to remote, but was no small part of what I worry about was, did we have enough people, enough staff to carry out the plan? Were people well? So, what's the impact of COVID on the staff in terms of their physical well-being, but also we live in a rural environment where it's actually quite difficult to staff certain kinds of positions, and particularly right now, for all kinds of reasons. And if we don't have enough dining hall staff to open, then it really doesn't matter how good our testing facility is if we can't feed students. So things like that, keeping tracks of dining halls and staff and custodians, has been one of the bigger data points we trace.
Awesome. Yeah, I think that the audience might have more questions after, but before we do so, Josh is going to ask a little bit about the plans for the future.
Yeah, I actually, since there are only 15 minutes left, I really want to give other people the opportunity to ask any questions. So I'm just going to go ahead and open it up to anybody. And if people don't, and I'm not expecting that people don't have questions, but if nobody has questions, I can go ahead and ask some. But I really want other people to get the opportunity to ask you some questions, President Mandel. So anybody that has a question, go for it.
I think I'm an alumnus, and I think Williams has done a great job in implementing this, implementing your program. And what I live in California, and the testing issues here aren't as good as sounds like you have there in Massachusetts, but there are new testing options coming up that are cheaper and more volume that should be available now or shortly.
Yep.
My question is, for us out in the community, where all the schools are wondering about opening, trying to open, whether it's public schools, private schools, K through 12, childcare, they're, trying to get started because it's so important to everybody. And we need to have what you did done by all those schools. And right now, none of this stuff is getting done as far as the testing, the identification of the patient, people who are affected, and most importantly, the isolation and tracing that you're able to do there, I think, more successfully because of the situation, but mostly because you've convinced everybody working there and the students that they need to cooperate and know what to do, and you're getting it implemented. Do you have any comments? And I'm worried that everything's going to go horribly bad this winter in the rest of the country because nobody seems to be thinking of doing what you're doing and implementing it and getting everybody to buy into it. Do you have any comments about how to save the rest of the country?
Yeah, I mean, so far, all I have to worry about is Williams College myself. I don't know if I can save the rest of the country, but I would say that, and as I've said before, that the modeling for September was very positive. The modeling for, February, not so much. So we can talk about that in a moment and see how that changes over the months. But, I think that it turns out, going back to kind of something I wasn't really thinking about, at least in a closed community like ours, testing made a huge difference. And then, and also, folks in the community, the students, the faculty, staff, people who live here, particularly the students that want this to be successful. So again, the kind of, I think everybody knows that from March, that if we have to, we'll shut. And so if folks don't want that to happen, behaving in a way that will keep us open is helpful. So sort of having people motivated to an end goal, I think is part of what's been successful here. Not so much coming, we try to emphasize that message, but not so much coming from me as a kind of collective understanding of what's at risk, leaving aside health being at risk. In terms of, the country, widespread testing, sort of shame on us, right, for where we got and what needs to happen in order to allow this to move forward. But I also think, and I think it's fair to say that we know a lot that we didn't know in September that I think school systems can learn from. And you don't need to be able to do exactly what we've done in order to be successful and open. I think that, we will even make some changes going forward. We erred on the side of caution in lots of ways, and some of those ways we're going to stick to because they worked. But there are things, for example, other schools, I'll just use an example. Other schools let students leave their rooms during their initial quarantine to get food. We delivered food to the door at Williams and stocked those micro fridges, which were a huge hit on our sustainability goals, but we thought that made a lot of sense. We put public health ahead of our sustainability goals in that moment. And we're not taking fridges out until the end of the year, and we'll continue to, during quarantine, to have food in them. But I think we probably will let students go out and get food during quarantine. Why? It was very heavy staff lift on the one side to do that. And on the other hand, we've looked at other schools who've been just as successful as we have, that have similar conditions, Bates, for example, that let students leave to get food and come right back to their room. And actually, they have one fewer case than we've had. That I wouldn't use math there to explain that, but I think that it suggests things we can do. Sorry?
I'm going to just turn off the projection.
Oh, okay. So I think the question.
Oh, is there a question on this?
No, well, no, there's a question.
But this way they can just see.
Oh, okay. Got it. So there's a question here in the room.
There's a lot of small businesses in town that I think probably rely heavily on college students
thanks. So I don't know if you all can, the question was, there are a lot of businesses here in Williamstown that depend on students for their income, and was that a part of our thinking? I mean, yes, although I wouldn't say it was a causal part of our thinking in the sense that I would have made the decision to go remote or not based on that factor. Pretty much my order of principles has been public health first, close second academic sort of curricular goals. So if we had gone fully remote, you all could have reached your academic curricular goals, presumably if the faculty did what they did this summer, which is think about how they could do this. So that was a close second. But still, we believe in a residential college, you can do that better here. So we were trying to get there. Those were the first two things, and they were way above everything else. Kind of you learn outside the classroom, athletics, businesses, everything else fell below those things, but certainly were in our thinking. And particularly, I'll tell you, there was a division of opinion in town about what we should do. So there were businesses who were very upset when we wrote out to the community and asked families not to go into town when they dropped you off. And we did that because other people were upset that you were going into town, your families were going into town. So we had some group of townspeople saying, oh my God, these disease-ridden human beings are coming to our town, and you're testing your own students, but the siblings, the parents, they're going shopping. We don't want them in our town. And then when we made that decision, we then heard from several store owners saying that should be for us to decide. We're following rules in our stores. You shouldn't make that decision for us. So there were, one of the things I always say as president of Williams is that we are a multi-cultural community. We disagree on every subject. I am the container for your disagreements, and this is an example of it. I wanted to actually share one other example of it. I've had a letter of complaint from somebody in the town who simply doesn't believe, either thinks we've been dishonest or don't understand our own data. So this is a data question. That's why I'm going to mention it. So we post, we're trying to be very transparent. How many people, there are things we've included and things we haven't included on that dashboard, but we're trying to make it clear to the town that we test. And in fact, if we didn't, the Broad would. Broad makes clear they're testing for the state of Massachusetts. But there's somebody who wrote me who clearly thinks either that we're not being honest about it or that there's something wrong with the test. And her evidence is that there was a rise in the number of COVID positive cases in Williamstown, roughly sometime between when you guys came back and now. And she pointed to the thing at Pine Cobble that happened and the thing, and the nursing home. There are a couple of little, actually, frankly, the numbers here are quite good compared to the state, so people can have data and still not actually interpret it the way I would interpret it, right? So I don't interpret what happened in Pine Cobble with anything to do. In fact, I know that it had nothing to do with anybody at Williams. But arguing that point doesn't make much sense with somebody who has a different point of view, is coming from a very different perspective. So, are there other questions?
Yeah, hi, Maud. Dick Piner, class of 69. Congratulations on doing what I think was the right decision. I'm just curious to know all the logistics that went into this. Did you have to use any outside consultants, outside firms, or was it all done in-house? And another quick question is, what factors are going into deciding when athletics start again? Thank you.
So on the first question, all decisions were made in-house. We didn't use any outside consultants in the sense of paid people that we were relying on. We did rely on a lot of outside expertise. So I do have a little group of public health professionals who are Williams educated, but then well beyond Williams, and who know a lot, and who have been honestly incredibly generous with their time and thoughts, and so that's been great. But we didn't do any consulting. The other sort of source of information I spend a lot of time, a lot more than I used to actually, in conversation with other college presidents, particularly in Massachusetts, but also in other places and different collectives. Zoom has sort of brought us together in a way that I think none of us would have ever been able to do before. And so there's a lot of information from other schools too. So that's another source of sort of what other people are doing, how they're solving problems. You know, there's nothing new under the sun. We've approached things in different ways, and there are good reasons we approach things in different ways, actually. What was right for Williams and for small, rural, liberal arts, isolated colleges is really different than if you were, you know, a huge institution or in a city. Like, the decisions just had to be different. And it's largely why we were successful. I like to take the credit, but you know, it's very hard to get COVID. The kinds of behaviors that are allowing COVID to spread in urban schools, it's hard to do here. It's hard to find a bar to go to, right? So it's like not that bad. Like, that was one of the sources in other places. So, there are contextual realities that have made it go better, and I really do believe I agree with what some of the large-scale public health experts said on this, that in September, which was, you know, what was good for one place was not necessarily good for another, and different institutions and types of institutions had to think this through. Athletics is an interesting question. Up until now, so we're in a league, and we've been trying to sort of follow what the league is doing. So one part of the answer to your question is, this is not one school's decision. We're in a collective group that is assessing the situation. I think all of us would love to get athletics up and running again if we could. In the fall, it was inconceivable. In the winter, largely indoor and therefore ill-advised in the what we're seeing. You know, the spring we'll have to see. There may be ways, if testing is going well and we can figure out some modified outdoor ways of, you know, only engaging with other schools with similar kinds of test rates. I don't know. We really haven't decided. And I think it's one of the things I want to stress here. It's not like, you know, we secretly decide things and then announce them as it sees fit. A lot of this is so happening in real time as information comes in. So one of the things I've said about athletics when people ask me now is, if I had to decide today, I would have to say no. So I understand indecision is really, really frustrating, but it's better to give me time, because the more time I have, the more information I have, I might be able to get to yes, but I can't get to yes from where I am now. I've had the same questions around reunions, commencement, like, you know, if I had to say right now, no vaccine, no testing infrastructure, you know, how could I possibly do those things? But information will become available, so we want to wait as long as possible. So the athletics, you know, we're shooting for spring, but, you know, there is a possibility we'll have to wait until we have you know, more vaccination availability. I don't know. That's a frustrating answer.
And then we had a question.
I've lost track of the time of the class. Is there?
We have time for one more question.
Time for one more.
Every clock in this room is at a different time.
Okay, so is there any? Yeah. Thank you. The happy moment. This is a silver lining. Seriously, I think so. The number one thing I didn't know was how people were going to feel about coming back. And when people asked me for advice, should I go remote or should I come back once we opened it up? I actually told a lot of people I thought they should go remote. I didn't think that being on campus was going to be a very good experience when stripped of a lot of things. And particularly for first years, to that question that came up, what I thought was, if you had a really good group of friends and you could get them in a pod, it could be really cool. You'd have a good pod experience and you'd take your classes and you could go deep into your classes, and that could be great. But that for a lot of students, that wouldn't be enough. And I just thought, you know, that it would be better to be remote. So it's one of the silver linings is to see how happy people have been just to be back. And frankly, you know, who cares? Masks, you know, who cares? I can't do this thing I used to love to do, but I'm doing this other thing I never would have done, or with this, you know, I'm having time with my friends, or I am digging deep into a class. There's been some silver linings having less to do and just having time to really focus on a few things. You know, it doesn't mean we're not going to go back to a cappella singing and, you know, riding horses and all the things we did. But for a brief period of time, that has, I think, been just to see the joy of being back. That's really been the silver lining. You know, at a personal level, and people talk about this, I've had family around in a way that I haven't for, at least not really at the moment, because my own son is now remote, but remote, he's studying remote and remote. So, but he was here for a perspective. And the other thing I will say about it,
Thank you.
one of the upsides, which has been, my life is actually, this has been some of the most stressful set of months, but I actually do much less. You know, there's fewer evening engagements. I used to, about a quarter of my time is on the road, usually. I travel. I haven't gone anywhere, and that's as you can imagine, I sleep more, I exercise more. It's also a downside, because actually I liked that part of my job a lot, and I miss the gatherings and the whatnot, but also here on campus with all of you, with, you know, faculty and staff. So, well, thank you for having me. It's great to see three-dimensional humans and some two-dimensional humans too. So thanks for your time. I really appreciate it. And wish us luck. We got to do it all again. So thank you.
Thank you.